Welcome to our session on the Redbook panel in the primary care sidebar. My name is Matthias and I work for RSCGP Oxygen, and I will guide you through today's session. The Redbook panel, when you open up a patient in Medical Director or Best Practice, will display a list of recommended preventative health measures, screening, similar activities, based on the current 7th edition of Redbook. So what it does, it looks at the patient that you're opening in your desktop application in your clinical system, and it applies the rules of Redbook, looking at age, gender, ethnicity and pre-existing conditions, anything that's been diagnosed that's relevant, and then displays the recommended screens. And I'll just show you how that looks like by opening up a patient here. This is the Medical Director demo database. There's no difference between MD or Best Practice. It will work exactly the same way. So I'm opening up, opening up a client called Max Andrews. So he's a 36-year-old male, and you can see in Redbook these are the recommendations. Now I've also opened up a client who is actually an indigenous client. He's a Torres Strait Islander. I put this in the client details, and that changes the recommended screens based again on recommendations for different population group, ethnicities and other issues. So Redbook looks not just at the age or gender, there's more taken into consideration. Looking at the colors you can see here, so there's no results entered. He's basically overdue for all of these basic measures, weight, height, blood pressures and so on. Also fasting blood sugars, microalbumin, smoking assessment and so on. The blue question mark is indicating that we cannot currently pull this information out of MD or Best Practice, and the red obviously is the overdue. You can scroll to the right and you can see here the recommendations, how often this should happen: every 12 months, every 3 years, depending what it is. So this is a very quick and easy way to see what the patient is actually due for or overdue for. Now, if you act on that and you say we're just entering a couple of results here, blood pressure, and we also put a height and a weight in there while we're at it, and a waist measurement. Yep, so we've got all of that. Medical Director calculates the BMI automatically there. I'll save it, close the screen. Within a second or two, you see that the Redbook has updated. And now we have most of the measures, the simple measures are green. There's only urinalysis missing and a couple of lab results that are outstanding. Now if you say you write a referral for this patient to go and get bloods done, fasting bloods, the red item will stay, the red icon here will stay until the results come back from the lab. And this normally happens electronically. So you download the results into your Medical Director or Best Practice, and sidebar will pick it up from there and will then apply the green tick as soon as the results have been received. You can also check now for those top items there, when are they due again? So based on the 12-monthly rule, so next year the weight and the height will become red again should you not enter another result since between then and now. If you want to know a bit more about the underlying rules of Redbook and where these recommendations come from, the second tab here, the life cycle chart, you can either go directly into a particular item, check for diabetes type 2 prevention, or you can click on the view life cycle chart, and this will show you a customized chart for the person you're currently looking at, in this case Max Andrews. So you can see his age and gender has come through, also that he's an indigenous client, and he's stuck at the normal risk here. This is the default setting. The colors indicate average, increased or high risk, and then you have a black line through there which shows you the age group our patient is in. And you can see there, so there's kidney disease is a higher risk for him because of he's an indigenous Australian, so there's increased screening recommended. And yeah, that's all basically in there. Any questions to the detailed information in here, say you wanted to know about the kidney disease, clicking on here will open another window, and that tells you the details there, what they recommend, what is it based on, the literature references and so on. So basically a very quick and easy guide to look at preventative health measures, what this patient has already been screened for and what is still outstanding. If you have any further questions to Redbook, if you want to know a bit more in detail how this works, clicking on the question mark here, as with all our panels, will open up a user documentation website, and you see there's a quick reference guide for the Redbook there. Just clicking on that link will open the quick reference guide. Thank you for spending the time to watch this little video clip. We hope this will help you with using Redbook and Sidebar in general. If you have any other questions that are not answered by this session or the manual, please feel free to call our help desk line 1-800-257-053. Thank you.